We use modalities like endoscopy, which is very, very important in diagnosing that one has a stomach ulcer. Hi, I'm Dr. Deepak Subramanian from Chennai Gastro Care. How does one know that they have a stomach ulcer? What are the symptoms and when should they approach the doctor? It's a very, very tricky question. Even for us as doctors, as gastrosurgeons or gastroenterologists, it is very difficult to identify if one has a stomach ulcer. We use modalities like endoscopy, which is very, very important in diagnosing that one has a stomach ulcer. Yes, but before doing endoscopy, there are certain symptoms or warning signs that we call as, which will ask us to which will probably tell us and tell the patient that this person probably has a stomach ulcer and probably needs an endoscopy. So those symptoms are, if you have an abdominal pain or an epigastric pain in the upper part of your abdomen, if you get pain, if you have frequent belching, if you feel that your tummy is a little full after food, if you find that you have a lot of heartburn or reflux-like symptoms, and if you also feel sometimes that your appetite is getting wavery or you're not able to eat the adequate amount of quantities that you were able to eat before, these are warning signs that we generally ask in a patient, and then we diagnose if they have a stomach ulcer or not based upon doing a simple endoscopic test. Now, once the endoscopy is done, that is when we also know whether you have an ulcer or whether it is simple gastritis or it is a reflux disease. So one must be aware of these red signs or red flag signs or warning signs, as I just mentioned, so that you can approach the right doctor and probably get an endoscopy done in the same time. Thank you.